All right, let's continue with heart sounds now. Now, if you listen to your heart, boom, 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 boom. You're like, okay, well, what's making that noise? What's going on here? And then when you go to the doctor's office, he or she will use the little stethoscope and listen for your heart sounds. Where are they listening to? What's going on? So, well, let's take a look here. Heart sounds are due to vibrations in heart tissues as the valves close. Not open, but they close. So this is remember on every quiz that we love to ask this question, what makes the heart sound? And students all the time, they always put, it's the opening and closing. No, it is the closing of the valves. So the heart can be described as a lub-dub, lub-dub, lub-dub. You can hear a dup or dub, but it's a lub-dub, lub-dub, lub-dub. The first out sound, which is the lub, occurs as the ventricles contract and the AV valves close. So the right and left AV valve, boom, they close. That's the lub, boom. The second heart sound, which is the dup, occurs as the ventricles relax and the aortic and semilunar pulmonary valves are closing. So the aortic and semilunar valves are closing, boom. So it's a lub, these two valves close, and a dup, where these other two valves close. Any abnormal heart sound, we call that a murmur, and it's due to some kind of valve damage. Okay. During the cardiac cycle, pressure within the heart chambers rises and falls within the contraction and relaxation of the atria and ventricles. Pressure changes open and close the heart valves. During early ventricular diastole, pressure in the atria is greater than the ventricles, which forces the AV valves to open. This allows the ventricles to fill. 70% of the blood flows passively from the atria into the ventricles before the atria contract. Pressure inside the atria rises further as they contract, forcing the remaining blood into the ventricles. During ventricular diastole, pressure inside them increases sharply, causing the AV valves to close and the aortic pulmonary valves to open. So when they close, that's your lub. During ventricular systole, papillary muscles contract, pulling on the chordae tendineae and preventing the backflow of the blood through the AV valves. As the blood is pushed out of the ventricles, then the pressure drops and the ventricles relax. When the ventricular pressure is lower than the blood pressure in the aorta and the pulmonary trunk, the semilunar valves close. Once ventricular pressure is lower than atrial pressure, the AV valves open and the process begins again. So it's the change in pressure in the chambers that causes the valves to open and close, open and close. So if you look at this, changes in the cardiac cycle, when the AV valves open, the aortic semilunar valves open, so and then the aortic semilunar valve closes. You can look at the aortic pressure. Okay, you have the AV valves open. You can look at the arterial pressure. So if you see the changes in the atrial pressure, the ventricular pressure, these changes is what's causing the opening and closing of the valves. You can look at what's happening here. Ventricular diastole, meaning the ventricles are relaxed. Ventricular systole, when the ventricles are contracting. So when we have ventricular diastole, ventricles relax, the atrium or systole contracting. When the atrials are relaxing, you have ventricular systole, which is contraction. Then you have a period of atrial and ventricular relaxation. Okay, so you have that. And then you have atrial contraction, systole, and you have ventricular systole. So if you look at the PQRS, okay, so if you this little slide shows you everything, what's happening at the heart sounds. This is in which part of the EKG you can hear the lub and the dub. The AV valves closing is the lub. The semilunar valves closing is the dub. Here's where the EKG is. Here's that P wave, right? P wave, atrial systole. You have the QRS, where the atrial diastole is there, but you have ventricular systole, and then you have the T wave, right? So you can look at the changes in atrial and ventricular pressure, and this change in pressure causes the valve to open and close, hence the lub-dub, lub-dub, lub-dub. So here you go. Remember, this is the superior vena cava. Here's the inferior vena cava. Here's the right atrium. The valve that separates the right atrium from the right ventricle is called the right AV or tricuspid valve. And then the blood is pumped through the pulmonary semilunar valve, through the pulmonary trunk, through the pulmonary arteries, goes into the lungs, comes back via the pulmonary veins into the left atrium, through this valve, which is called the left AV valve, left bicuspid, or left mitral valve. And then you have the left ventricle, which pushes it through the aortic semilunar valve, through the aorta. So where can you listen to these heart sounds? So if you wanted to kind of remember a mnemonic, which is kind of cool, it's All People Enjoy Time magazine. So all is for aortic, and the aortic valve, the best place to listen to that is the second intercostal space. So remember, here's your rib 1. Here's rib 2. So on the right side, in between ribs 2 and 3, the second intercostal space is the best place to listen to the aortic valve on the right side. Now immediately across to the left of that, you can hear the pulmonic valve, which is found in the left intercostal space. Now, in the third intercostal space, that's the best place to hear S1, S2, which is your lub-dub. Lub-dub. So if you wanted to just kind of get a general idea if the patient has a good heartbeat, Erb's point, S1, S2 is a good place to start, which is in the third intercostal space. If you want to be more specific and listen to these valves, then you can go to the tricuspid valve, which is around the lower left sternal border, or the fourth intercostal space, and that's the tricuspid valve. And then if you want to listen to the mitral valve, which is the left fifth intercostal space, medial to the midclavicular line here. Okay. And that's probably the best place to listen to this. Okay, so again, the lub is the tricuspid and mitral valves closing, or the right and left AV valves closing, which is the beginning of systole. And then the aortic and pulmonic valves, when they close, that's the dub or the dup. You can hear DUB or DUPP, it's all the same. That's the end of systole and beginning of diastole. So you get the lub, dub, lub, dub. The best place to listen to S1, S2 is Erb's point, which is the left third intercostal space. But if you want to listen to the aortic valve, you can listen to it at the right second intercostal space, the pulmonic valve at the left intercostal space, the tricuspid valve at the lower left sternal fourth intercostal space, and the mitral valve as the left fifth intercostal space.